Today I am answering 10 SIBO questions. I am a nutritionist working with irritable bowel syndrome and SIBO, small intestinal bacterial overgrowth, and these type of questions are typically the type of questions that are asked by my clients in my own practice. So let's get to it. Question number 1. Should I treat SIBO naturally with herbal supplements or with a course of antibiotics? You should absolutely consider choosing herbal supplements for SIBO treatment, as herbs are just as effective as pharmaceutical antibiotics. And also, they are more natural and less harmful for the gut. So the only downside is that the course of herbal treatment takes 2 to 3 weeks longer than regular antibiotics. Question number 2. Is it true that eating healthy foods such as fruits and vegetables will aggravate your SIBO symptoms? The answer is yes, absolutely. When foods are high in fiber, they are a source of nutrition for the gut bacteria, both good and bad. So these bacteria then ferment these fibers and produce gas that will aggravate your SIBO symptoms. This is why you should consider avoiding high fermentable fibers called high FODMAPs during SIBO treatment, and perhaps adapt a low FODMAP diet together with a low carb diet as well. This is called a SIBO diet, and I have already done another video on this topic, so I put a link down below that you can click on and go check it out, where you can learn more about what is a SIBO diet. Question number 3. How long does it take to treat SIBO? So it depends on type of diet and antimicrobials that are used to treat SIBO. Elemental diet takes around 14 days to complete, whereas a low-carb diet is a minimum of 4 weeks with a restricted phase and then additional phase of 4 to 6 weeks of food reintroduction. And there is also a difference in the time frame if you treat SIBO with a course of pharmaceutical antibiotics versus the natural herbal supplementation, which typically takes 4 weeks to complete. Question number 4. What is the best clinical test for diagnosing SIBO? Well, currently the best way to diagnose SIBO is by using a 3-hour lactulose breath test. Stool testing provides information regarding the large intestine and therefore has no diagnostic benefit with respect to the small intestine, which is where SIBO occurs. However, stool testing can be beneficial as it provides an overview of which specific type of bacteria is overgrown in the stool, providing more clues about what types of overgrowth it might be: H. pylori, streptococcus, yeast overgrowth, etc. Organic acid testing, so-called OAT test, can also give clues, looking at other metabolic byproducts that are correlated to SIBO. Both OAT and stool testing are only indicators and are therefore not the accurate way to test SIBO, and they are not as accurate as the lactulose breath test. SIBO should therefore be diagnosed and treated based on the lactulose breath test and perhaps in combination with a stool test. Question number 5. What is the difference between SIBO and Candida? So SIBO means small intestinal bacterial overgrowth, which means that it's bacteria that is overgrown in the small intestine. Candida is a fungus or yeast that can also multiply and grow in the small intestine, as well as other parts of the body. We all have Candida present in our bodies, and it is where there is a excess or overgrowth of Candida that can become a problem. The treatment protocol of SIBO and Candida is somewhat similar, although there can be features that can vary in this protocol, as yeast bacteria might have a different effect specifically on the supplementation used for this treatment, which is also why testing for SIBO is essential prior to the treatment. Question number 6. Is it normal that my symptoms get worse after starting herbal supplementation? So the answer is yes, it is normal. In SIBO treatment, there is a phase called kill-off phase, which typically starts at the very beginning of the SIBO treatment, as the wrong imbalanced bacteria reacts to the treatment, defending itself by producing gas and toxins, which can make you more bloated and cause fatigue and loss of energy. But this typically goes away after 3 to 5 days, and you should then start to feel much better. However, if the side effects are persistent, and you perhaps feel sickness, nausea, diarrhea, then you should either lower the dosage or stop the course of antimicrobials completely. But remember to consult with a healthcare professional both before and during SIBO treatment. Question number 7. Is it normal that I am more constipated after starting a SIBO treatment? The answer is yes. Some people can experience that they get more constipated after starting a SIBO treatment. However, this happens more for those who choose a low-carb diet. This typically improves after around 2 weeks into the diet plan. However, if the symptoms are persistent, that might mean that you are one of those people that do not do well on a high vegetable fiber diet, and you should then consider treating SIBO with another diet option like elemental diet or carnivore diet. Question number 8. Is it normal that I get diarrhea after starting herbal treatment? The answer is no. It is not normal to get diarrhea. This type of side effect usually means that your digestive system is too sensitive to the treatment and that you should probably stop the treatment and consider alternative treatment options. Question number 9. Can I drink sugar-free soft drinks during SIBO treatment? No, do not drink sugar-free soft drinks during SIBO treatment of any kind, as sugar-free drinks usually contain artificial sweeteners that are known to harm and damage the healthy microbiome and the good bacteria in the gut. Also, there are various studies pointing out that artificial sweeteners might feed the wrong imbalanced bacteria and therefore worsen the SIBO symptoms. However, stevia is a type of sweetener that is not fermented by the gut bacteria and can be used during SIBO treatment. So that could be an alternative option for artificial sweeteners. My advice is to stay away from any type of sweeteners during SIBO treatment, just in case. And the last question, question number 10. Can I eat histamine foods like tomatoes, spinach, avocados during my SIBO treatment? So the answer is yes and no. A great deal of individuals that suffer from SIBO also experience problem with histamine digestion, which can lead to allergic reactions both inside the digestive system and the rest of the body, causing symptoms like cramping, gas, itchy skin, skin rash, fatigue, and other symptoms related to histamine intolerance. In that case, it could be a good idea to eliminate histamine foods from the diet as well during SIBO treatment. However, if you do not experience any of these types of symptoms, you should be okay with eating avocados, spinach, and other high histamine foods. If you have a SIBO question, then remember to put it in the comment section below and I will actually answer you. And please remember to like this video and subscribe for this channel if you find this information useful. Thanks for watching.